by Aisha Abdool Karim. She's a journalist with Bhekisisa Centre for Health Journalism. Aisha, thank you very much for availing yourself this afternoon. So if you're asking yourself why government decided to adopt this compensation scheme in the first place, what do you need to understand?
Yeah, so I think the first thing that people should understand is that the fund is really here to help them and to make the process of accessing compensation for vaccine injuries easier. It's not an indication that the vaccines are unsafe. In fact, why South Africa chose to go the route of implementing this compensation fund is so that we could get vaccines into the country faster and sooner. It was a clause that the pharmaceutical companies required for vaccines that we procured directly from them. So typically, the liability would fall to the manufacturer. But with the COVID vaccines, the pharmaceutical companies asked countries to take on the responsibility should any injuries arise. And that's, again, not to say that the vaccines are unsafe, and we were expecting a lot of injuries, but it was just that this fund exists so that if you do experience any kind of negative response after you have a vaccine and it's serious and you need to be compensated, this is a much easier way for you to access that money and get compensated for the injury as opposed to going through the normal court processes that would be required.
Aisha, what do we know about who funds this? Essentially, as you mentioned, is a condition that was part of the exchange, and it was requested by these companies that manufacture vaccines. So who carries the cost of the scheme?
So the cost of the scheme falls onto the government. So Treasury had to allocate certain funds to go into the scheme. It has not yet been made public exactly what amount of money has been put into the scheme. So we don't know how much money can be paid out of the scheme. What we do know is that it's about a year since the scheme was first announced, and so far, no claims have been paid out or no claims have been made to the scheme. So I'm not sure exactly how much money the government has put towards it, but there are substantial funds that are being made available should they need to be paid out through the scheme. I think it's also important to note that people aren't able to just make a claim. There's a very strict process that's in place, and it's a scientific process where you need to report any side effect or any reaction you have after vaccination, and that has to be reported to the country's medicines regulator, which is called SAHPRA. There's an app that you can do it on in your phone, or you can go to your healthcare professional and they can file the report for you. Each reaction is then investigated, so you need to submit certain information, and there's a process by which they investigate each symptom to find out if it's just coincidence or if it is in fact linked to the vaccine itself. Only once the expert committee has determined the cause of the reaction, so once they determine that it was indeed caused by the vaccine, then the fund will get in touch with you to help facilitate you making a claim to be compensated for any injury that you sustained from the vaccine.
Sure. As you mentioned, it's not known just how much an individual can claim or overall how much it is costing the taxpayer, and no one has come forward to claim, and it's almost been a year. Are you aware of conversations from some sectors of society that say, well, why do we still need to have this in place when we can redirect that money into places like Charlotte Maxeke, for instance, upgrading that, fixing various ailing hospitals in the country?
Yeah, so again, I think it's just important to note that the reason we have this scheme is because it's part of the procurement negotiation. So in order to buy the vaccines that we got last year, we had to create this fund, and the money that was allocated to it has been designated by Treasury. And so even though no one has claimed from it, the fund exists to cover the around 20 million vaccine doses that we procured last year. The fund is not there forever. It's not. It doesn't just exist with no conditions. It applies specifically to those vaccines that we bought from the manufacturing companies, and it applies only to people who got their vaccine in South Africa at a registered vaccination site from a registered healthcare professional. So the fund covers a very specific group of people and a very specific batch of vaccines in the country, and it is part of that clause that the manufacturers made us put onto buying those doses. So it's not money that can easily be reallocated until the date at which the fund no longer applies. And it isn't just covering anything. To get compensation out of the scheme, you have to fall into like 3 very specific categories. So it covers temporary disability for the period in which somebody is injured after vaccination. It covers permanent disability, and it covers death as a result of vaccination. But each of those cases has to be very carefully assessed and investigated, and then the claim can be made. But that will only be paid out for the period in which we are using the vaccines that we bought last year. Once we start getting in new vaccines that are coming in through, for instance, the vaccine mechanism COVAX, then those vaccines aren't going to be covered by the fund. So it's not an indefinite scheme that's going to just continue paying people out.
I don't want to condemn unreasonably, but I do wonder, though, that, was it worth it, especially when we see the very low levels of vaccination in the country?
So I think it's important to understand the context in which we did this, in which we chose to procure these vaccines. We had a new variant in the country. We had the Beta variant, which was proving to be much more serious than the original version of the virus we had circulating in the country. We had high levels of infections. We had a very, it was a devastating wave where we lost a lot of lives. And vaccines continue to be the best protection we have against severe disease. And so while there has been a drop in uptake, it was definitely worthwhile to get the vaccines into the country and to make them available. And I think that people who are not vaccinated as yet should definitely be encouraged to go and get their vaccine, because we know that the pandemic is not yet over. We know that COVID is still in the country, and we are about to head into another wave in the coming months. So it's imperative that people go and get their vaccine if they haven't as yet, because it is our best chance at fighting and stopping this virus.
Aisha.